Our final panelist is Mr. Steve Kirsch, who also joined us last year. He's a former Silicon Valley high-tech executive. When the pandemic started, he created the COVID-19 Early Treatment Fund. Thank you for doing that. To fund research is working on repurposed drugs. Mr. Kirsch has also testified before the U.S. Senate and presented, as I mentioned, here last year. Welcome back to Pennsylvania, sir. Over to you.
Thank you, Senator. We're, I guess, over half an hour over, so I'll just be brief. I had a lot more to say, but in the interest of time, I'll cut to the chase. I'm going to talk about the elephant in the room. This is the biggest thing that we should be discussing that nobody has talked about, which is that all these vaccines are causing harm to our kids. It's not just the COVID vaccines. It's every single one of them. There has never, ever been a study comparing the fully vaccinated kids who follow the CDC schedule versus kids who have not been vaccinated at all, who did not get a vitamin K shot, which is not a vitamin, and whose mother did not get vaccinated. If you compare the results of kids whose mom didn't get vaccinated, no K shot, and no vaccines, and if you compare the outcomes of those kids versus kids who got the CDC schedule, there is a dramatic difference. It is an unbelievable difference. It is a difference that nobody wants to talk about. There are no studies, zero, that show the opposite. They tried to get the CDC to do a study of the vaccinated, fully vaccinated versus the fully unvaccinated. In 2005, CDC Director Judy Gerberding promised to do such a study. She said, yes, we should do such a study. It's important that we do a study now. We can refine it later. And that was nearly 20 years ago. And that study has never been done. And it will never be done because they don't want people to know that all these vaccines have been harming people since the very beginning. There is no safe vaccine, not a single one. Not one vaccine is safe and effective. I talked to a doctor who makes about $500,000 a year, and he said, I could make $1.5 million a year if I vaccinated all my kids. He gets a $1 million reward if he vaccinated 95% of his kids or more. $1 million, an extra $1 million if that's why. It's the doctor's job to try to vaccinate your kids. It's the parents' job to say no.
The background here is that I've worked for the health service all my working life, and I worked in academia all my working life. And you always got to do what the senior people tell you. So if the consultant says, John, go and give a particular treatment, you might say, well, are you aware of this factor or that factor? And if he or she says yes, but still give that treatment, then you do it. you do what you're told. There's a hierarchy in healthcare, and we have to be obedient. There's a hierarchy in healthcare, and we have to be obedient. There's a hierarchy in healthcare, and we have to be obedient. There's a hierarchy in healthcare, and we have to be obedient.
Steve, thank you for your testimony. It's great to see you again. Thank you. And this wraps up our roundtable. Thank you so much, everybody.
There was a bit of controversy, some headlines at the beginning of this year's festival when it was announced that this film called Vaxxed would be screened at the festival. Later, the festival pulled it. Was it because of the backlash? Were you surprised that people reacted the way that they did?
I was shooting a movie. I was in the middle of a lot of stuff. I think the movie is something that people should see. There was a backlash which I haven't fully explored, and I will. And I didn't want it to start affecting the festival in ways that I couldn't see. But definitely there's something to that movie. And there's another movie called Trace Amounts. And there's a lot of information about things that are happening with the CDC, the pharmaceutical companies. There's a lot of things that are not said. I, as a parent of a child who has autism, I'm concerned, and I want to know the truth. And I'm not anti-vaccine. I want safe vaccines. When you get, some people can't get a certain type of shot, and they can die from it. Even penicillin. So why should that not be with vaccine, which it isn't?
So you said
all.
you went public for the first time saying that your 18-year-old son does have autism.
Yes.
That had been a very private thing for you. And
Yes.
part of the reason you wanted this film shown was to start that conversation.
Absolutely.
Do you believe you'll now have a role in that conversation going forward?
Possibly, yes. Because the thing is that to shut it down, there's no reason to. If you're scientists, let's see, let's hear. Everybody doesn't seem to want to hear much about it. It's shut down. And you guys are the ones that should be the investigating. Do the investigating.